Welcome. Today we're diving into a rare but important condition, desmoid tumors of the bowel. These are non-cancerous growths that start in the connective tissue of the abdomen. While they don't spread like cancer, their aggressive local growth can cause serious health issues. Imagine roots pushing through concrete. These tumors can invade organs, blood vessels, and nerves in the crowded abdominal space. The journey often starts with confusing symptoms, leading to a diagnosis that's both a relief and the beginning of ongoing care. Our goal is to provide clear, reliable information about what these tumors are, how they're diagnosed, and what treatment involves. Knowledge empowers patients to ask the right questions and work closely with their healthcare teams. For those with unexplained abdominal symptoms or a family history of certain genetic conditions, this information is crucial. We'll break down the science, symptoms, and treatment options for managing these challenging tumors. Living with a desmoid tumor requires resilience and a proactive approach to healthcare. Treatment decisions are highly individualized. What works for one may not work for another. Understanding the condition allows for better conversations with doctors and more control over your health. Let's begin this important discussion together. So, what is a desmoid tumor? Also called aggressive fibromatosis, these tumors are made of fibroblast cells, the same cells that form our body's connective tissue. In desmoid tumors, these cells multiply uncontrollably, creating a dense, fibrous mass like scar tissue gone rogue. Unlike cancer, desmoid tumors don't metastasize, they stay where they started. But benign doesn't mean harmless. These tumors can grow into nearby tissues and organs, causing serious problems. In the abdomen, they might wrap around the intestine, press on blood vessels or invade muscles, leading to pain or even bowel blockage. Their persistent infiltrative growth can be as damaging as cancer, even though they don't spread. This dual nature, benign yet aggressive, makes them a unique medical challenge. Treatment varies widely. Sometimes doctors recommend watchful waiting, other times surgery or medication. The tumor's behavior dictates the plan. It's never one size fits all. Ongoing research aims to predict which tumors will stay stable and which will grow. This helps doctors and patients make better decisions in the face of uncertainty. Understanding this paradox is key to managing desmoid tumors. Why do desmoid tumors develop? Genetics play a major role. Many cases are linked to familial adenomatous polyposis, or FAP, an inherited disorder caused by mutations in the APC gene. People with FAP have a much higher risk of developing desmoid tumors, especially after abdominal surgery. Physical trauma or surgery can also trigger these tumors, often at the site of previous operations. Hormones, particularly estrogen, are another factor. Desmoid tumors are more common in women and can grow during pregnancy. Some cases are sporadic, meaning they occur without any clear genetic or hormonal trigger, often due to random mutations in genes like APC or CTNNB1. Not everyone with risk factors will develop a tumor, and some people get them with no known cause. This unpredictability makes desmoid tumors especially challenging. Understanding your risk can help guide monitoring and early detection, but sometimes these tumors just happen, without warning. Symptoms depend on the tumor's size and location. Persistent abdominal pain is common, ranging from a dull ache to sharp cramps. The pain is often chronic and worsens as the tumor grows. Changes in bowel habits, constipation, diarrhea, or incomplete emptying, can signal a tumor interfering with the intestines. Severe cases may cause bowel obstruction, with symptoms like intense pain, bloating, nausea, and vomiting. This is a medical emergency. Sometimes a firm, immovable lump can be felt in the abdomen. Unexplained weight loss or a general feeling of being unwell may also occur, though these are less specific. Some tumors are found incidentally during scans for other reasons, especially in people with FAP. Even without symptoms, regular monitoring is crucial for high-risk individuals. Early detection can make a big difference in management. Always seek medical attention for sudden, severe abdominal changes. Diagnosing a desmoid tumor starts with a patient's symptoms and medical history, especially any family history of FAP or prior surgeries. A physical exam may reveal a lump or tenderness. Imaging is key. CT and MRI scans show the tumor's size, location, and relationship to nearby organs. These scans help doctors plan the next steps and assess potential risks. A biopsy is essential for a definitive diagnosis. A small tissue sample is examined under a microscope to confirm it's a desmoid tumor, not cancer. Biopsies are often done with a needle, guided by imaging. Genetic testing of the tumor can reveal mutations in APC or CTNNB1, confirming the diagnosis and sometimes uncovering undiagnosed FAP. This information shapes both treatment and family screening. Accurate diagnosis is the foundation for effective care. The process combines history, imaging, biopsy, and genetics. Each step ensures the right management plan is in place. Once diagnosed, treatment is tailored to each patient. Sometimes the best approach is watch and wait, monitoring the tumor with regular scans if it's small and not causing symptoms. Some tumors remain stable or even shrink without intervention. If the tumor grows or causes problems, surgery may be considered, but it's complex and carries risks, including recurrence. Surgery is now reserved for critical cases like bowel obstruction. Radiation therapy is another option, but it can damage healthy tissue and is used selectively. Medications are increasingly important. NSAIDs, hormonal therapies, and low-dose chemotherapy can slow or stop tumor growth. Targeted therapies which block specific growth signals are a promising new frontier. These drugs are often better tolerated than traditional chemotherapy. The choice of treatment depends on the tumor's behavior and the patient's needs. A multidisciplinary team helps weigh the risks and benefits. The goal: control the tumor while preserving quality of life. The outlook for desmoid tumors of the bowel is generally good. They don't metastasize, so survival rates are high. However, quality of life can be affected by pain, complications, and the risk of recurrence. Tumors often return after treatment, especially surgery, so long-term follow-up is essential. Recurrence rates can be as high as 60%, making ongoing monitoring with scans and exams critical. Complications like chronic pain, bowel obstruction, or nutritional issues may require a team of specialists. For those with FAP, genetic counseling and regular surveillance are vital. Avoiding unnecessary abdominal surgery can help reduce risk. Early detection allows for less invasive management and better outcomes. Prevention isn't always possible, but proactive care makes a difference. Open communication with your healthcare team is key. Stay informed, stay vigilant, and partner with your doctors. With the right approach, most people can manage this condition effectively. Knowledge and support are your best tools for navigating life with a desmoid tumor.